All right, Frank, thanks so much. Well, millions seek plastic surgeons each year for a little nip and tuck here and there to make them feel and look a little better. This morning, plastic surgery after major weight loss. From the Plastic Surgery Group, Dr. Michael Leadbetter. Good morning. Good to see you. First, I must ask you, how does someone find the right plastic surgeon for them?
I think the important thing when you're choosing a surgeon of any type is that the surgeon's board certified in their specialty. The easiest way for a plastic surgeon to find a plastic surgeon is to go to the website for the American Society of Plastic Surgery, and all board certified physicians will be listed there in the different areas of the country. And the other way to find a good surgeon is to talk to your family physician. Most family physicians know who the better surgeons are, and they'll refer you there.
All right, great advice. Today we're talking about after major weight loss, kind of helping the body get back into place, and so plastic surgery after that. Let's take a look at some pictures. Okay. Now, is this a one-time surgery deal, or how does this work?
What you're seeing right there is a one-time surgery situation. This is a woman who has lost a lot of weight. She has a very heavy upper arm and a lot of laxity of skin. So in her case, we're helping her to recontour her arm so that she can fit her clothes better, feel better about herself, and get over the changes that have occurred because of her massive weight loss.
Okay, let's take a look at our next group of pictures.
This is a similar situation. This is what we call an upper body, lower body disproportion. And in this person's case, you can see they have extremely heavy abdominal tissue. They've lost a lot of weight, their skin has relaxed, they have a lot of problems with contouring their clothing. And in this case, we do what's called a lower body lift, where we make, or a circumferential abdominoplasty, where we make an incision all the way around the body. It's sort of like a little person in a big pair of pants. What we're doing is we're contouring the pants to their new body. And that's what we've done in this.
Is this something that you do in one surgery?
This can be done in one surgery.
So yes. What's recovery like after a...
Most recovery at this time, I tell most people that if everything goes well and there's no healing difficulties of any sort, it's going to take about 6 weeks for them to get back into their regular routine. And each week they're going to get more active. They're up and around right away, but obviously they have to limit their activities until the healing takes place.
Is this outpatient surgery?
No, these are usually, lower body lifts are usually done as an overnight stay in the hospital, 1 to 2 days, and then usually home.
Okay, I think we have one more group of pictures to look at.
Yeah, this is a more limited type of an abdominoplasty, and this is a person that has a more difficult problem. This is a person, if you look in the center of the preoperative photograph, they have a large abdominal hernia. So we do a lot of reconstructive work when we also do body contouring, because they've lost contour of their abdomen. They may have a hole in the abdominal tissue. They may have extreme weakness to their abdominal muscle. And in this case, we've not only repaired their profile, but we've repaired the strength of their abdomen. So in this case, we've repaired the hernia, and we've also contoured their body.
What price range are we looking at for something like this?
It varies depending on what you do. It can be anywhere from $5,000 to $15,000 depending on what you have to do. And these are staged procedures. A lot of people don't realize that we see a lot of people after gastric bypass today, and they feel the gastric bypass is a big operation, which it is. But the body contouring portion of their reconstruction can actually be much bigger, because you're dealing with a lot larger areas, a lot more potential for blood loss and things like that. So it's really a procedure that takes a lot of planning and a lot of safety.
Wow. Doctor, thank you so much.
You're welcome.
Stay with us. More on the X in just a moment.